A patient comes to ultrasound department with lower abdominal pain and irregular menstruation. On scanning, this is uterus shown by arrowhead and a cyst with a large solid component in right adnexal region. Bladder was partially filled. You can see the large solid component inside this cystic area. This is probably endometrioma. Upon angling the probe towards a bit left side, there is an other cystic area, but this is simple cyst, no septation, no solid component, no internal echoes were seen in this cyst. The cyst with solid component could be a hemorrhagic cyst. It was also containing some fine septations. The pain to the patient was of mild degree, not heavy pain. Measurement of these cysts were the cyst with the solid component, that was endometrioma or hemorrhagic cyst, was 82 millimeter and the simple cyst was of 72 millimeter.